In the past couple of months, 7 young people in the Northern Territory have taken their own lives. It sparked outrage in the community with a suicide rally held at Parliament House in Darwin this week. Community groups are calling for a royal commission into Indigenous youth suicide and want funding for diversion programs and yarning circles where people are encouraged to get together and talk. The Vice President of the Territory's Australian Medical Association, Dr Robert Parker, joined us earlier today. Dr Robert Parker, welcome to the program.
Thanks very much, Letitia.
Are we facing a crisis in youth suicide in the Northern Territory?
Well, it's a bit early to tell. Certainly I appreciate there's been a apparent rise in young people with suicide recently, but because of the small population in the Territory, it's very difficult to get accurate data, and you've often got to do it over a number of years before you get trends, so it's very it's too early really to say at the moment.
You've been in the Northern Territory for a long time. Have you noticed anything with the trends?
Well, at times there appears to have been a definite increase. At times you've actually had spikes, such as the spike on the Tiwi Islands in the early 2003-04 period. And then it sort of gets better again for some reason.
And as far as the Territory goes, we're nationally significant when it comes to our suicide rates.
Well, I think it's well recognised that unfortunately the Territory's got the highest suicide rate in Australia, and suicide of Aboriginal people is again very significant in that regard.
Is it the case then that we need a royal commission into Indigenous youth suicide?
Well, again, I think the causes of suicide are reasonably well recognised. And again, there's been recently a Senate inquiry into suicide. There's been a number of very well conducted studies into youth suicide. And I mean, there are key factors that impact on it, particularly education. I think it's well recognised that Year 12 education tends to protect against suicide. The recent work that came out of the Billard Suicide Summit in the Kimberley last year that really talks about a home, so emotional nurturance of young people, rather than just a house and the support they need. There's been some very good work recently done in Melbourne by George Patton, looking at ethics and the sort of quality of education young people get in terms of their self-respect and decision-making, all of which impacts, I think, on emotional resilience and also protects against suicide.
Well, Con Vatskalis, the Health Minister, was talking at the suicide rally this week and spoke about the solution lying in homes. Is that realistic then, or is it a cop-out from government?
No, I think it gets back. Mary Victor O'Reilly, who was one of the key people in the Suicide Summit last year, really brought up the concept of a home. And a home is where kids get love and support and nurturance and can pursue their intellectual and emotional needs. But again, education is very important as well, and the ability of, it's very well recognised that people who have got through Year 12 are much more empowered in respect to their health than people who haven't got to Year 12. And that's an important issue too for mental health.
One of the stories that was shared at the rally was that of a young man who had been twice to the hospital showing signs of suicidal tendencies. Twice he'd been released, his family hadn't been notified, and that young man went off to commit suicide. Doesn't that show a system in crisis?
Well, again, there are a number of factors that impact on one particular assessment, and these are assessments I do on a regular basis. I mean, people's risk can change from hour to hour and from day to day. There's a certain number of issues about the rights of the individual, and again, holding people against their will under the Mental Health Act. We've got to balance those needs. And so someone may present an ED, they may, after a period of assessment, appear not to have the risk factors, but then that may change in a couple of days depending on life circumstances, substance abuse and whatever. So it's a very difficult thing to say one particular assessment can lead to something else from a variety of factors. Obviously notification to family is an issue, and that's something we may need to follow up further.
Yarning circles have also been raised as a possible solution. The community has been loath to talk about suicide in the past for various reasons. Is this something that you see as a healthy step forward?
Well, communication is an essential part of community resilience in respect to mental health. I mean, this was particularly shown on the Tiwi Islands as part of their suicide prevention strategy, again following the epidemic there. And what happened it was yarning, but it was yarning about life issues. It wasn't particularly talking about suicide, but it was the way to talk to your wife, the way maybe to deal with stress rather than getting drunk. So it was actually looking at a healthy approach to life's issues and talking about it in groups of men and women. And that's the sort of yarning I think I'd prefer rather than particularly focusing on suicide as such.
What are the other solutions that you see are being needed?
Well, again, some of the ones that are there at the moment, I mean, you've got the Clontarf Academies into high schools at the moment. That's a very worthwhile program that encourages further education and resilience in young people. There was the Mind Matters curriculum in high school. I think that could help, that could be resurrected to again give people information on mental health and emotional resilience. All of which, and again, the factors on what can nurture young people in a home environment, and looking at those factors, particularly the current review of facts, which I think will hopefully improve to a review of facts service, and therefore the benefits to young people who've got emotional needs.
Dr. Robert Parker, thank you for joining us.
Okay, thanks, Letitia.